have done this, but I've been avoiding things today, so why not make a YouTube video? It's the perfect thing to do when you're avoiding stuff. Yeah, want to know what I'm avoiding? Writing a letter to my brother. Because he's in rehab, right? And today is his birthday. So he's not around. I really want to tell him happy birthday and how glad I am that he's still on this planet because he's really given us some scares. So, happy birthday, Peyton. And I'm so proud of you for being in rehab. And I'm so glad that you're still here with us on this planet. However, back in January, February-ish, right when this whole cancer thing went down, I asked him to please get his shit together because I kind of needed him around and, Anywho, so he didn't. Long story short, he went to jail, he got out of jail, he did more drugs, now he's in rehab. And now I'm avoiding writing him a letter talking about my feelings. But instead I'll just talk to you guys about my feelings, right? Yeah. Okay, so that's out of the way, the whole Peyton deal. We're still avoiding it. What else is going on? Oh yeah, look at all this hair. It's really sweet. Oh, I can run my fingers through it. Like I can grab onto it, but not so much so that say you cut off my head, this is not going to make a great handle. You'd want to hold onto the ear or something to carry the head around after it's been chopped off. I've been watching a lot of Game of Thrones, so that's where my head went. Anywho, yeah, so I got a lot of hair, and it's coming in curly, I think. You can see this little whoof, whoof. There's a natural little whoof that I got, and if I push everything down and forward like this, I look like I'm going to the middle school dance. Yay! Oh, because I got this. You remember when guys used to do this in middle school? It just was totally flat and then spiked up at the top. Well, I sure do remember. And now I've got that haircut. It just grew in like this. So that's cool. Yeah, also, I've got another surgery coming up. A week from today. 7 days till the next surgery. And I'm pretty fucking nervous about it. I'm not gonna lie. I've had to start taking the Ativan again just to kind of calm myself through the day-to-day. You would think that the last surgery with the double mastectomy, right, with the drains and all that, you would think that would be the worst surgery, right? Because it's more intense, and that was a 4-hour deal. This one's only 2 hours. But what's gonna happen is they're gonna go in through the same incision right under here, right? They're gonna lift up my skin like the hood of a car, and they're gonna take out the tissue expanders and put in implants, right? And the difference between the tissue expanders and the implants is that the tissue expanders are hard. They feel like little turtle shells in here. They're not especially comfortable, right? The longer I go with them, the more comfortable they get, but they'll never be comfortable, right? When I move, they don't really move with me. They just push back against it. It's not a fun time. Anywho, the implants are gonna be softer, right? They're called gummy bears, gummy bear implants, because they're the texture of gummy bears. You can't pop it. These are full of saline, right? They pumped them up full of saline. If I were to pop one, the saline would just go all over the place. But with a gummy bear, right, there's no saline in there. It is literally the texture of a gummy bear, and you can't pop a gummy bear, right? You can squish it, but you can't pop it. So, anywho, they're also going to do some fat grafting, and this is the part that's got me nervous, right? So they're going to do lipo in my stomach and in the muffin top area around here, and they're gonna get fat, and then they're gonna squirt it around up through here because you can't really tell, right? But there's some concave areas of my chest where it's just flat kind of dip boob, right? And it's a real obvious difference, right? Where it's just concave and then great big boob. So they're going to fix that with some fat grafting. They're going to inject some fat in there, make it look more normal, less lumpy. And that sounds great, right? But as it turns out, lipo is serious business and hurts like a bitch, is what everybody tells me. All the message boards say lipo's no joke. The doctor, I had my pre-surgery consult, and I was like, let's talk pain levels, man. I've read some stuff on the internet. And he was like, the internet's right. You're going to be 10 out of 10 pain for the first 48 hours, and then it should dissipate after like a week or so. But then some people can still feel it after like a month. So there's just no telling where I'm going to end up on that spectrum. I know I'm going to be down for at least a week, maybe 2, right? And that I'm really, really dreading it. I really don't want to be down again. I'm really enjoying like raising my arms over my head like this. This is so great. I'm not going to be able to do this in a week. So I really got to enjoy it now. And stretch and move and stretch and, sleep on my side. That's another thing. I'll have to pull out the wedge pillow and sleep sitting up. It's not fun. Surgery really, really sucks, right? Like super duper sucks. So I'm not looking forward to it at all. But based on everything that I've been through thus far, I know that I will make it through this and I will be fine. I'm just really kind of dreading the next couple of weeks. And to make things worse, well, it's not like I drink all the time, but I did happen to note on my little paper from the doctor, it's no alcohol 1 week before or 1 week after. Like, I just got back from vacation with my best friend Emmy, right? We went to this farm in the middle of nowhere, and we got some Trulies. Those, like, alcoholic spiked seltzers. It's alcohol water is what it is. Flavored alcohol water. And we got drunk, and it was nice, dude. I haven't been drunk since, I don't know. Sometime last year. Definitely not 2020. So, even though 2020 really calls for a drink, I have not been drinking. It's just not my deal. But, with surgery coming up and, like, I'm trying to, like, fit in all the time with my friends that I can, like I went on vacation with Emmy, and I went and got coffee with my friend Jeff yesterday, and this weekend we're going to go up and see friends in northern Kentucky and watch the UK game. I'm pumped. I haven't seen them all year. So I'm excited to see all my friends, and I'm excited to do all this stuff, but, a drink would be nice. Just like one, it only takes 3 to get me hammered, so like 1 is good. Maybe even like half a 1. But the paper says no alcohol, so I guess no alcohol. I guess maybe some rules were made to be broken. And as much as I really like being a good patient who follows all the rules, I'm just getting a little burnout on all this cancer, pandemic, being sick, recovery type thing. It gets old. It gets real old. So, yeah. I'm just trying to do as much as I can while I can still do it. But also not have like an anxiety attack while I'm doing all these things, because my mind does wander back to the surgery. So, but after the surgery, that should be my last one as far as like reconstruction goes. Yeah. And then I think my only other surgery after this should be the port removal surgery, which is actually not going to come until like May-ish, I think. I haven't really done the full calculations. I thought it was going to be done in March, and then when I started the Kadcyla injections, they told me it was 14 rounds, 3 weeks between each round. So, I mean, that's going to end up being more than like 6 months. So I was bummed, and I thought, like, maybe by my birthday next year, I'll be totally done. You know, I'll have my port out and everything, and that'll be like my birthday present is I'll be done with cancer. Which would be an awesome birthday present. But it doesn't look like it's going to work out that way. So it's okay, because the Kadcyla is way better than chemo. Like, way better. I mean, it still sucks. Gives me some stomach aches sometimes some headaches. But yeah, it's not nearly as bad as chemo. Like, I can still do most things. Yeah, I haven't had really any problems. It's hard to tell how much of this is anxiety. You know what I mean? Like, I've only had 4 of them, and I don't get a lot of side effects. But one of the potential side effects that you can have is a stomach ache, and by golly, I get those. But who can tell? Who can tell if it's the IBS or the anxiety or the Kadcyla? It could be any of those things. It could be something I ate, you know. So there's just a lot of reasons why my stomach could hurt, and I try not to focus on any of them. Just try to make it not hurt. Sometimes Tums helps. Sometimes. Sometimes you just gotta wait it out. That seems like a lot of this. A lot of this is just wait it out. There's a light at the end of the tunnel, so just head down, power through. You can make it. That's been like my whole year so far. So, and I'm doing it. I'm chugging right along, and things have gone as well as they could possibly go, right? Like, every time I get on the message boards, I see women that have it way worse than I do. Way, way worse. And so I'm really glad that everything's gone as well as it has. That being said, cancer is still a great big bitch, and I promise you don't want to fuck with it. Like, ever. So, if, like, you know, if there's the potential to get cancer in doing something, you should really think twice before you do it. So, like, smoking or, you know, sunburns or, I don't know, eating too much processed food. Whatever it is, think twice, because cancer blows. So, yeah, PSA for today. I guess I've been going at this for 13 minutes now, which is probably enough. I'm sure you're done listening to me talk. So I'm going to sign off here, and maybe I'll write my brother a letter. Maybe I'll clean my house. Who knows? Who knows? Who knows what I'm going to do? But I'm going to sign off here. So see you in a few weeks. Farewell, farewell.